So this is part two of my presentation. My second evidence-based journal is minimally invasive versus open surgery for acute Achilles tendon rupture, a systematic review of overlapping meta-analysis. So this included 4 studies with only randomized controlled trials included. There was no significant difference in rupture, re-rupture, tissue adhesion, or sural nerve injury, or deep infection or deep vein thrombosis. The minimally invasive surgery or procedure had a decreased superficial infection rates and had better patient satisfaction outcomes between good and excellent. This suggested that minimally could be a better choice in a lot of cases. The reason I included this study, even though it didn't include non-invasive, is because when I started the research, I didn't realize that there was actually 2 types of surgery that could be performed. So I figured this would be a good one to add in. And let's see, surgical versus non-surgical treatment of acute Achilles tendon rupture, a systematic review of literature and meta-analysis would be my third evidence-based journal. So this was 9 studies that looked at 822 patients. So that was a large sample size. It was pretty much evenly split, with 415 being surgical and 407 being non-surgical. There was a 12-month follow-up. And the surgical included both minimal and open procedures. So operative had a decreased re-rupture, but a higher incidence of surgical complications. So surgical had a 3.6% re-rupture rate, and the non-operative had a 10.1 re-rupture rate. And there was no statistical difference between functional outcomes or deep functional outcomes, range of motion, deep vein thrombosis, or superficial infection, deep wound infection, sural nerve lesion, or a return to sport. So the conclusion of this study was open surgical outcomes can be minimized by utilizing minimally invasive techniques instead. And one thing I would say is I read several different articles or journals, and that 10% was actually a pretty high rate. It was a good sample size for that study, but the outcome was higher than some of the other sample size. Re-rupture did tend to be more significant in the non-surgical versus the surgical, but that was probably the highest percentage I saw of all the studies I read. So operative versus non-operative treatment for acute Achilles tendon ruptures, a multi-center randomized trial using accelerated functional rehabilitation. So this was a randomized study with 144 participants, 72 with surgical and 72 non-surgical.